family dynamics can sometimes be very tricky, and it really takes a little bit of gauging the feel in the room. I used to be very afraid of seeing somebody with a family member in the room. It used to be very intimidating, but now I almost feel intimidated if the family member is not present for at least part of the visit, because I think, am I getting all the information? Is there something else I'm missing? And it's really nice having that person there.
Children, first of all, are very poor at recognizing that parents have memory loss. They tend to let it go for years, and they say, oh, that's just mom or dad. You know, they're just a little old and stuff. So the first thing you've got to recognize is have people screened on a regular basis. With the rapid geriatric assessment, we're now providing screenings on a regular basis at St. Louis University and in the community so that people can get screened early. If a problem is picked up early, it's much better.
I always start by talking to the patient, but I always have a peripheral glance on the family members in the room. How is that person reacting to what the patient is saying? And then I always bring that person in to contribute to the conversation with permission from the patient of giving more information and opinions of what's going on. Then at the end of the visit, I always give education to both parties. I talked primarily to the patient, but then I allow the family members to ask questions, clarify anything that I have told and educated, and it's a process. I get to know my patients and families over a long period of time. I always promise them after the first visit that it's not enough. Bring them back soon to really get to talk through some of these issues and get to know each other better.
The big piece about it that's very important is we have to work with the children along with the parents and make sure that they're all on the same page. It becomes very important to look at advanced directives if somebody's losing their memory or having problems, because large numbers of people in Missouri don't have advanced directives in place. And without advanced directives, things can go really wrong. If you get sick, you come to hospital, physicians will do all sorts of things. So having good advanced directives, knowing what you want to have done for you, not what somebody else thinks you need to have done, makes a big, big difference. And then as long as you and your children are on the same page, this will be carried out and you can have a good end of life. It's very important. Compassionate care at the end of life is far more important than having some neurosurgeon rush in, put a burr hole in your head, walk out, and then watch you die 5 minutes later. And unfortunately, too often, we have physicians who are too eager to treat the untreatable.
So it's really important just to open up that communication, start having those conversations. Over time, they get more and more difficult. They get more and more complex, more and more deep, and that's what we want to get to.